but that we are still confronted with the matter of ensuring quality learning and teaching, and these will of course continue to be a key priority for us within the basic education sector. In higher education, the new bursary scheme will continue to support the access and success of poor, talented students. We will also give increased attention to steering young people towards professions and disciplines in which we have skills shortages. We will devote greater attention to monitoring and evaluation in higher education to ensure we are meeting our targets. Policy inadequacy in areas such as the lack of gender equity among staff in our institutions, the subject of gender equality and safety for women staff and students must and will be addressed. The adoption of the 2018 Science and Technology White Paper creates conditions for science, technology and innovation to expand its contribution to achieving our National Development Plan Vision 2030 goals. In order to make the necessary advances, government must increase resource allocation to science and technology, and greater efforts will be directed to public-private partnerships that will expand research development and innovation. We speak as well this year of celebrating our 25 years of democracy as a free South Africa. 25 years ago, on 27th of April 1994, the South African people changed the course of history and broke the bonds of colonialism and apartheid. You delivered on that day a decisive majority victory to the African National Congress, with a mandate that gave authority to the African National Congress and to our beloved President Nelson Mandela to assume the responsibility of building a better life for all South Africans. Our manifesto of 2019 is our vision and plan. It calls the nation to celebrate 25 years of democracy. It is also about transforming the economy, serving our people, advancing social transformation, building safer communities, continuing the fight against corruption and promoting integrity, strengthening governance and public institutions, building national unity, and embracing our diversity while also focusing on South Africa, Africa, and the world. So then, what have we achieved since the last mandate you gave to us? Since 2014, in the basic education sector, we have today 9 out of 10 South Africans able to read and write. That is 94.3% of our population. In 1994, it was just 61% of our population. We have also added a year of schooling to prepare children for school, the grade R. We now have over 700,000 children accessing early childhood education, and this is our statistic from our last financial year. We have established a firm foundation for a comprehensive early child development program that is an integral part of the education system. We are also targeting schools with poor infrastructure, and since 2014, about 225 schools have been replaced. We are making progress with upgrading schools that do not have water or sanitation, and about half of these that have been identified in this government term have already been fixed. This year alone, we will spend 6.8 billion rand on feeding learners through the National School Nutrition Program. This is 6 times more than the 1.2 billion rand allocated in 2007-2008. We will spend 185.5 million rands on learners with intellectual disabilities this year, which is almost 3 times the amount of 72 million spent last year. About 95% of textbooks of high enrollment subjects and all workbooks have been digitized, and these are now the intellectual property of the Department of Basic Education. With respect to the college sector, since 2014, our government has prioritized free education for college students from poor and working class families. During the period 2010 to 2016, college enrollment increased from 358,393 students in 2010 to 703,705 students in 2016. It is very clear to many of you that despite the increases we've seen to funding in technical and vocational education and training colleges, we still have a challenge with respect to student performance and need greater improvement in this area. We're continuing to update TVET college curricula in order to make learning outcomes current and relevant to workplace practices. In 2017, African students constituted 92.4% of college students, followed by students from the colored community at 6.3%. In universities, we've also marked important advances. By 2015, Black African students comprised 75% of total enrollments at our universities, a significant majority. Between 1994 and 2014, the number of black graduates with degrees being produced each year has more than quadrupled, a massive advance, from around 11,339 in 1994 to 20,513 in 2004 and 48,686 graduates in 2014. Last year, we introduced free higher education for students from poor and working class families. The scheme that we introduced in 2018 is being phased in over a 5-year period. This year, government will be providing 30.8 billion rands in grants to 750,000 students. Again, a very huge increase in a very short space of time. In addition, the sector education and training authorities continue to offer over 290,000 learnerships and apprenticeships, as well as internships to young people. We also have made progress in the domain of science, technology, and innovation since 2014. It is our government's role to seek to ensure investment in, promotion of, and to catalyze science, technology, and innovation in South Africa. It's a key strategic area for our country. Our government acts as a catalyst for innovation in a number of national priority areas. We chose in 2008 5 specific, what we called grand challenge areas, in which we catalyzed leading edge innovation. These were global change, renewable energy resources, space sciences, the bioeconomy, and the human sciences. These are not for us simply grand challenges. They are global challenges that need global collaboration and cooperation in solving the problems confronting the world. Government's role is to catalyze investment in key multidisciplinary areas that will drive innovation in all sciences. Our country, South Africa, in partnership with several other African countries, made history when they secured the right to co-host the Square Kilometre Array, the SKA Global Radio Telescope Research Infrastructure Initiative. The bid, supported by South Africa's construction of the exciting Advanced Meerkat Telescope, a precursor for the SKA, and several human capital development programs, has contributed immensely to raising interest in science, technology, and engineering across Africa. In fact, many thought this was an astronomy project, when in fact it is an engineering and information technology challenge in research. As a result of our focus on astronomy sciences, partnerships with multinational companies related to information and communication technology engineering, which are all required for radio astronomy, are proving to be thriving partnerships, with African expertise becoming a sought-after source of innovation for a number of companies. In the domain of health, since 2014, much progress has been recorded. We all know from reports in the media that more South Africans are living longer, with average life expectancy increasing to 64 years in 2018 from a low of 53 years in 2005. This progress in the increase in life expectancy reflects on the main improvements in the quality and availability of health care. Our massive campaign to turn the tide against HIV and AIDS has begun to note successes. It is also this change the results of our efforts to meet basic needs like access to clean water, electricity, and adequate housing. More than 4.5 million South Africans with HIV receive antiretroviral treatment, up from 2.4 million in 2014, making our program the biggest antiretroviral treatment program in the world. We have made dramatic progress in the prevention of mother-to-child transmission of HIV. In 2004, over 70,000 of babies born to HIV-positive mothers became infected. By 2018, this figure had plummeted to 4,500, saving tens of thousands of newborn babies each year. New HIV infections have decreased, but we cannot rest. Our collective fight continues for an AIDS-free generation. In 2009, there were 69,000 TB-related deaths, and by 2016, these had dropped to 29,000. Again, the fight against tuberculosis must be strengthened and continued. We've seen access to free primary health care expand from pregnant women and children under 6 years of age in 1994 to free primary health care for all today. So, having given you that overview of what has been achieved since 2014, let me turn to what we plan to do as our commitment to continue to serve you in creating a better life for all. Together with the people of South Africa, we as the ANC are ready to write the next chapter in our country's history. The ANC is eager to once again serve and work with you to move our country to greater heights. By opening up the doors of learning to all, by focusing on quality and innovation, we will equip young South Africans for the world of tomorrow. This is at the heart of our ANC skills revolution documented in our manifesto. In our next term, we plan to do the following with respect to skills. We intend to act on our promise to make 2 years of early childhood development compulsory for all children. We intend to continue to appoint and improve the quality of our teachers, to develop their skills, and to enforce accountability in our basic education sector. We will continue our investment in and work on replacing unsafe and inadequate school buildings and sanitation facilities. We will extend free higher education for the poor and develop a model to address the needs of the so-called missing middle. We will also intensify our implementation of the three-stream model in the basic education sector of academic, trades, and occupation streams. We will implement a mass apprenticeship program across the economy. We will also, in the area of health, do the following. We will implement the National Health Insurance Scheme to provide quality health care free at the point of service. We will improve the quality of the public health sector as the backbone for South Africa's unified national health system. We will take urgent steps to fill critical vacant posts in public health facilities. It is our intention to expand the primary healthcare system by absorbing over 50,000 community health workers into the public health system. We will also intensify our efforts against tuberculosis by screening an additional 2 million people for tuberculosis and treat those who are identified as having the disease. We also will intensify our investments and work in the sector of science, technology, and innovation. It is our intention to strengthen the legal and regulatory framework for the promotion and achievement of innovation. We will work with stakeholders through the Presidential Digital Industrial Revolution Commission to shape a common digital future that places people at the center of digital transformation and ensures that its benefits are spread across society. We will increase spending on innovation and aim for more technological breakthroughs critical to the country's development through support for research. Small, medium-sized, and micro-industries will be enabled through focused support to play a major role in the promotion of growth and employment through technology and innovation-focused SMMEs. We will scale up skills development for the youth in data analytics, the Internet of Things, blockchain and machine learning technologies to enable training of young people to develop and operate new technologies. We will work with partners to train workers and unleash their talents and creativity. A just transition framework will be developed with all stakeholders to address reskilling and support for workers displaced by new technologies. We will also continue our work at reducing the cost of data through the work of the competition authorities and, of course, we hope through the communication regulator, ICASA, thus lowering the cost of data, which will be one of our major requirements in the licensing of the much-needed radio frequency spectrum, which the Minister of Communication has spoken of recently. These, then, are the actions that we intend to take to build on the successes that we have already achieved. We have, in conclusion, emphasized through this manifesto that our plan is your plan. It is by all of us, and it is about all of us. South Africans, black and white, young and old, rural and urban. We firmly believe that the coherent and achievable plan set out in this manifesto responds adequately and appropriately to the needs and aspirations of all South Africans. You have helped the ANC to develop this manifesto through your contributions, so we must work together to effectively implement it. So let us work together to grow South Africa together. Thank you very much.
Thank you very much, ladies and gentlemen. I hope Our media statement was very comprehensive. We will now immediately open up for clarity-seeking questions. Then we'll allow members of the panel to answer all the questions. So what we are going to request is that you introduce yourself and the media outlet where you come from. Can we get hands? Yeah. Can we get hands for questions? Oh, you are number one? It's clear. You are number two? Let's take then the first round. Yeah, you can start.
Okay, thank you. EWA News. Mr. Randall, when we talk about the breakdown of the money that is given to students and NSS, basically, can you just give us a bit more comprehensive what will happen? Is it going to happen in a way of the announcement you made recently regarding the close to, I think, R1 billion going to that, but also when you hear you saying that it's going to new students, like higher education, you're getting more comprehensive. So just a breakdown of how that work in terms of finding them, especially the middle missile and the poor, because quite a situation where they always want to find out exactly what's going to happen there. It was announced, but how it's going to be phased through that money, what happens, who gets funded exactly. So thank you.
Number two.
Myself from ANC. My question would be related to health, to the Minister of Health, Dr. Aram. I see here in your statement, just the health, the Education and Health Subcommittee, we do not make reference to some of what might say unfortunate situations that may have unfolded in the health sector, such as the recent story that was done by a colleague of mine, Maseko Rashaka, of the baby who the mother was given birth, and the baby basically different parts of the body, of the child's body were coming out, and the child died. And how do you fix a deplorable public health care system where you've had oncology problems in the province of KwaZulu-Natal under the leadership of NEC's Monsenito, where in Limpopo recently the NEC of Health will be basically lambasted public servants who did not purchase necessary equipment for the public to have those equipment so that they can utilize them, basically signaling that the government of the day and with the public servants, they are failing to provide services to the people of that particular hospital in Limpopo. When you come to the life of tragedy that took place here in Gauteng, how do you fix a deplorable healthcare system that is heavily constrained? And in the words of David Makura, it's more constrained now with more and more foreign nationals burdening the healthcare system. How do you fix it? Then with Mamla Lady Panda, when it comes to higher education, what is your overall plan for next year's general intake within tertiary institutions to make sure that process by those who are student activists don't escalate to the level which they've escalated in the past 2-3 years? We've seen the millions of rands that you recently rolled out for historical deaths to students. When would those students be getting their qualifications in order to enter the job market? Thank you.
No, thank you very much. We will then allow members of the panel to answer to the question that has been asked. Immediately thereafter we'll take the second one. Over to you.
Thank you very much. I think all my questions come from Samkelo Maseko. Starting first with the issue that was in the media about the baby who was decapitated, that our statement is not mentioning it. I've responded to that. Both the TV station you are representing followed me to Tembiza Hospital on Thursday when we were launching the Lancet report on TB. And they asked me nothing about TB, they asked me about this issue. And I responded, the first thing I said, let us not become specialists or experts in the field in which we do not qualify. What has happened is a very painful thing, but let's leave the experts to deal with it. The cry in the media is that that incident could have been forgotten if an emergency Caesar was done. That's the cry I've heard. And my response, and they said I was protecting the doctors, I said I stopped practicing 25 years ago. But in my knowledge, I would not have performed such an emergency Caesar. Because Caesars are performed for two, and only two reasons on earth. Firstly, to save the life of a baby, and secondly, to save the life of a mother. If you do a Caesar for any other reason, then it's wrong. And I know that in South Africa, Caesars are always done for wrong reasons. That's why the rate of Caesar internationally, according to the World Organization, is 15%, meaning 15% of pregnant mothers ought to deliver by Caesar. But in South Africa, in the private sector, it's more than 75% now. And in the public sector, 23%. That's way out, because they are being done for wrong reasons. But having said so, I'm not making a judgment call. I'm just explaining to you the way I understand the practice of obstetrics and gynecology. But tomorrow, the chairperson of the Confidential Committee on Maternal Mortality, what we call Saving Mothers report, Professor Jack Mutley, together with the chairperson of a committee called NAPEBCO that deals with child mortality, Saving the Babies report, together with the head of the Department of Obstetrics and Gynecology at the University of Natal, who has been sent by the South African Society of Obstetricians and Gynecologists, who are experts in the field. Tomorrow, they are starting an investigation on this issue. Gauteng has done its own investigation, but I thought because it happened within their midst, perhaps they might be prejudiced on their side. I'm getting those three experts. They are studying tomorrow. They'll give us a report on Friday. In other words, they want to check in their knowledge of obstetric and gynecology what has been done. Is it according to protocols? Is it what is practiced generally in obstetrics and gynecology? Could something different have been done? Because what you are giving me now are anecdotes and emotion that flows out from the public after something that they do not understand happened. I'm going to make that report very public about the investigation of those three. The Obstetric and Gynecology Association have got what they call peer assessment mechanism, where you assess your peers whether what they did is according to the practice of that particular profession. So these are very serious experts in the field. So let's wait for their report. I'll definitely deliver it to you. The issue of oncology, you are aware that there's an explosion of cancer internationally, and also in our country. The situation that happened in KZN was unfortunate, but it's now behind us. You are aware that we hired through Vets University, through what we call Vets Health Consortium, to contract oncologists in the private sector. Because our healthcare system is skewed, all the skills are in the public sector. 80% of our skills and specialists, are in the private sector, saving only 16% of the population. That's our problem. So what we have done, we've contracted them. Since last year, they are seeing 450 patients every month. Now we want to expand this nationally, not only in KZN. And there's been stories here, which I need to correct. Maybe I'll take this opportunity, that we have given that tender to Discovery Health, and quite a number of people are worked up about it, and they raise it all the time with us. What happened is that we advertise a tender, not for people who do this oncology, but to a company that will manage it. In other words, just like the Vets Health Consortium, they are not seeing, the Vets Health Consortium is not seeing 450 patients every month in KZN. They manage the process of making sure that private oncologists come and see those 450 patients. Now we wanted to extend it nationally, and we advertised that tender. And there were, to my knowledge, I don't deal with tenders. That's another problem we're having, Comrade Naledi. Everybody in the public say ministers must not deal with tenders.
Saved us, though.
Yes. If you don't deal with them and something goes wrong, you are the one who is responsible. I actually don't know how to save that. I mean, to deal with that. I was staying away from this tender. I understand there were 5 entities, if not 6, which applied. It was University of KwaZulu-Natal, it was Walter Sisulu University, it was the Vet Health Consortium, which I spoke about, it was Metropolitan Life, it was Discovery. And I can't remember the 6th one, but it looks like there were 6. And it looks like at some stage during the tender process, there was a clamor to give it to Discovery because they were saying it is giving the lowest price, etc. But it was found to be irregular and illegal. So at the moment, we have got no tender at all. Absolutely nobody is having this tender. The Vet Health Consortium is continuing the one in KwaZulu-Natal. The one nationally is not there. And the decision that we've taken was that the department must administer itself. And this is what we're doing. In the next few days, we will issue a public tender to ask private oncologists, specialists in that area, to come and be on our database. And this also deals with psychiatry, because we have even asked about life is dementia. I'll actually jump to that question. So they will be on our database wherever there are lots of people who need services. Then we'll look into the database and get those oncologists. We'll no longer rely on any private company to give it to us. So there's no tender given to Discovery Life. I'm repeating that. Let me jump over, maybe deal with this, because it also, you ask a question about it, which comes later, but I'll take part of it now. About life is the main, how do you fix this system? There's no question that there is an explosion of mental health problems in our country. It's also global. It's a global phenomenon. And the World Organization called a conference in 2013 to deal with the issue. We also called ours, but let me focus to what is happening home. You know, the suicides which are happening, in our country. Yesterday we had a painful situation where we're burying the daughter of our chief whip. Last year we buried a world-renowned scientist, Professor Mayosi, because of these things. And they just continue. But what is the situation in South Africa? Again, the issue of shortage. There are 700 psychiatrists in the whole of South Africa. There are 700 psychiatrists for a population of 57 million. 525 of them are in the private sector, saving only 16% of the population. The remaining 175 psychiatrists who are serving the public sector includes lecturers in the universities, lecturers in psychiatry, because they are also serving in public hospital. We include them in that 175. It's a very small number, so this is what we have done. Again, we have issued a tender which also started war at the same time with this oncology. And these 5 entities again applied. We are not going to give it to any one of them. We are going to follow the same route of oncology. We will ask on our database psychiatrists all over the country, especially in the private sector, to come and register on our database. When we found problems with people who need psychiatric care, they will go there and deal with the issue. Again, following life is the main, I'm sure you are aware that the Human Rights Commission issued a report on Thursday. After they studied the whole situation inside the country, they issued a report with recommendations to Department of Health nationally, all the 9 provincial departments, Department of Justice, Social Development, Human Settlement, Correctional Services, SAPS, and even the Public Protector. They've issued recommendation that this is what they must do. Sorry, I forgot basic education. All those departments were issued the recommendation. Lastly, we have asked one of the pharmaceutical companies, and in this case is Sanofi, which is helping us with most of our anti-TB medication. We have asked them to do their social responsibility, and they have started. We said because of this shortage of psychiatrists in the country, we're not going to make it. Training a psychiatrist from the time they get into medical school until they are a psychiatrist, it takes 13 years. So we said we need to do things that can solve the problem urgently. Sanofi is going to train 1,000 doctors and nurses per annum. We take doctors we call medical officers. That means those who have completed internship and community service are working. We collected them for correctional services because there's a problem there. We take them from district hospitals. We're also going to take them, Minister Pando, from nurses who are running clinics at universities or colleges. They must have a clear psychiatric training. That training has already started with 80 doctors and nurses in the Eastern Cape. By the end of this year, we'll have done 1,000 and we'll keep on continuing. And Sanofi is paying for that. And we are calling over many others in the private sector to come in and help. So that is we're trying to respond to the liveliest demands of this world, but also to the explosion of mental health in the country. The other question you ask is how to deal with a heavily constrained healthcare system. I'm happy that you actually describe that issue of heavily constrained healthcare system. And we believe some of the things are self-made with our structural problems. Because we ask ourselves, the first thing that we are going to do in the first 5 years is NHI, which many of you are trying to fight against. But our question is this: our healthcare system is constrained in the public sector. Because how do we continue running a healthcare system where 4.5% of the GDP goes to serve only 16% of the population, and the remaining 4.2% of the GDP goes to serve a whooping 84% of the population? That situation exists nowhere in the world. Meaning South Africa is spending already 8.7% of its GDP on health. That's a very high figure. But we are having these problems of constraints. It's very high. Why am I claiming it's high? Because the average figure in a European country is 9%. There's many European countries are spending 9% of their GDP on health, and they've got no problems. We are spending 8.7%, but the manner in which it's distributed, 4.5% to only 16%, and the remaining 4.2% to 84%. That leads to the constraints, which you say the Premier of Gauteng was speaking about, huge constraints. So NHI wants to say this 8.5% of the GDP must be distributed equitably to all the citizens of the country so that we do away with the constraints. That's basically one of the fundamental foundations of why we need NHI to fix it. Now, the other issue on fixing it, we have never denied that there are problems in the quality of care of the public sector. In fact, our NDP has flexed it long ago. I mean, they've shown it long ago that there is this problem. So what have we done? You will remember that last year in October, the president called a health summit, which was attended by 600 individuals from all the sectors. And we've drawn up a plan, and that plan culminated in the opening of a war room in the presidency. Last 2 weeks ago, every sector, including government, presented what they are going to do in the war room to improve and fix the healthcare system of the country. But I want to emphasize, the first place to fix the healthcare system is equity. You can't keep on having such a grossly inequitable healthcare system, which exists nowhere in the world. And actually, I'm challenging you, go and check the figures I've mentioned. There's no country in the whole world that has got as much inequality in healthcare as South Africa is, despite spending this much money on healthcare. So, thank you very much.
Thank you very much, Minister Motsoaledi, for those responses. Let me explain to the young man from EWN News how the student funding works, because I think there is a lot of misunderstanding. Firstly, let me refer to the figure of 30.8 billion rand, which is for this incoming financial year. And that money is to support the old NSFAS funded students who were on that threshold, which was very low of 122,000. You'll remember that. Now, those students are the ones who are the debt-ridden, because to meet the costs of higher education, they had to borrow. And the lender was universities, right? So the debt is with universities, and I'll explain how we're going to deal with that in a moment. So the 30.8 billion is to continue supporting those ongoing who are still in the system, what we call continuing students. But the bulk of it is going to go to those students who are in the new national bursary that is offered by the National Student Financial Aid Scheme, which now targets many more young people because the income threshold has been raised from that ceiling of 122,000 joint family to 350,000. Then you cover many more. So this is the scheme. If your family has a joint family income of 350,000 or lower and you need assistance and apply to NSFAS, you will be termed eligible on application. Should all the investigation find what you submit is true, and upon registration, you then begin to receive funding. And this is a problem, I think, of understanding of the scheme. People think that if we wrote you a letter last year and said you're eligible, you don't require registration, but you have to be registered, because it's only on the basis of record of registration that we disperse the funding. And that's the 30.8 billion. So it's continuing students, it's first years in the new bursary scheme, and second years from this year. As you know, we're phasing in over 5 years. The reason we said 5 years, in the National Student Financial Aid Scheme program, we know that many of our young people come from backgrounds where they won't be able to complete the academic program in minimum time. So we have an N+2, so 3 years being minimum for an undergraduate degree, and 2 more years if you succeed, but with requirements for meeting, academic achievements. So that's the 30.8 billion. Now the 967 million that I announced a week ago comes out of what was the core subject of protests this year, which is continuing students with historical debt. The matter of historical debt was also part of the Fees Must Fall campaign, but government said we need to identify what the quantum is and who the persons, the students or graduates are, in order to be able to take action. We found as we did the assessment that we were more easily able to identify continuing students with historical debt than those who have exited the system. So the one of those who are out of the system is still being done. But we've quantified those in the system and owing universities as 52,540, and the sum owed as 967 million plus however many other rands. And we know per university the amounts we're talking about. So this is what will be now allocated to NSFAS, and they will disperse as per the results found by the team that was carrying out the assessment for us. I hope that kind of explains it. Then on plans for the beginning of the year, well, the thing is, if students decide that they're going to protest before the academic year has even begun, registration had hardly started and you already had protests, it's quite a difficult problem for us to stop. And I think students need to be the ones who determine that the academic year will get off smoothly. I am quite concerned that we do have a delay in the start of the. I don't think it's good for our academic profiling nationally and internationally. But what we had done, and which we will of course continue to improve upon next year, we release funds upfront to institutions to disperse to students. So that release was based on the assumption that registration would speedily get underway. Once registered, students deemed eligible will receive their funding. But because they disrupted during registration, we were unable to release the funds because they were not registered. So it became a kind of circle of, a problem. So we'll continue to work with students and try to get up to a point where we have improved stability in the system. But I must say, if one were to take all 50 colleges and all 26 universities, actually you'd be able to confirm that we haven't had the level of disruption that we've experienced in the past. Nevertheless, any delay in the start of the academic program is a worry, and we must improve our efforts at ensuring that administratively we're ready and we get funds out there. I must say credit to the administrator of NSFAS and the staff working there, because we've had a vastly improved beginning of the academic year in comparison to any other time in the past. I think that was all.
That's all.
We'll take another round of hands. Can we get more? Let's start with number 1, number 2, number 3, number 4, in that order.
Good afternoon, Suniki from the Citizen. I'm bouncing off of some remarks that you made about the constraints in the health system and comparing it to the GDP expenditure of other countries, and ultimately deciding that the major factor was the inequality in the health system that you have in the public sector. I'm curious to know if the ANC has a plan specifically to deal with whether or not your opinion on record is that foreigners, immigrants, are a constraint. How far must I have it? Can I just not use it? I can just not use it. It's cool. Is it? So I'm curious to find out if the comment you made about how immigrants have an effect on how the health system works as a whole, just because of the numbers that are unplanned. If the ANC has a plan to deal with that in the future, to have a more comprehensive plan to deal with immigrants who are healthcare patients.
Hello, I come from the Academic Transformation Action Group, which comprises basically of your black academics who are in the medical field. I'm one of the people that probably would not have made it to medical school, would not have made it to become a doctor if it wasn't for this government. So it saddens us.
I didn't hear that. The last sentence.
I am one of those people who probably wouldn't have made it to medical school, who wouldn't have made it as a doctor if it wasn't for this government. So we are here to engage. And it is my absolute pleasure to see the Minister of Education and the Minister of Health sitting together. Because the elephant in the room is the College of Medicine of South Africa. The College of Medicine of South Africa is having a gatekeeping mechanism. The gatekeeping mechanism that you have at the College of Medicine of South Africa has led to Professor Hefe having to step down. He's a very respected professor, but the system is not made with black people in mind. We cannot feed into those systems. Mr. Kando is going to be spending money on a system that is not accountable to anyone. Even today, you will not get your scripts when you write your exams. You will not even get access to it. They've signed non-disclosure agreements from people that have failed many times who had actually passed the exams. And the people that are suffering is the National Department of Health because they are spending money on specialist training in the country. It is not the universities that are losing money. We're sitting with a situation as well from medical schools where we have lack of governance. We're sitting with universities that should not be training doctors, but they are. And I'm very much well aware that NMU is going to get a license to train doctors, whereas we already have governance issues at Walter Sisulu. We're also sitting with head of departments that have never produced even a single cardiologist, but they've been in those positions for over 10 years. I think we definitely need to have political oversight at the College of Medicine, political oversight over your medical schools. We are dealing with a situation here whereby our black academics are being sabotaged. They are being victimized. Their lives are at risk for standing for the truth. We cannot have a system that is built on inequality. We all know that in South Africa, for you to go to good schools, it will depend on where you come from. If you live in town, you're going to go to a regional hospital and be treated by a highly qualified doctor. But if you live in a village, you're going to go to a clinic and die in a village. I urge the Minister of Health to make sure that all our regional hospitals are areas of excellence. It's not only the cancer crisis that KZN is dealing with. We're dealing with the radiology crisis. If you look at the outputs, they do not exist. At least SAICA is very honest. They're sending out the pass rates that are declining every year. It's on their website. The College of Medicine will not tell you how many people wrote exams, how many passed, and from which universities those people come from. Even hosting
as we summarize.
Yes, even hosting from HPCSA has actually admitted in a lot of the meetings that he has no control over the College of Medicine. He's tried to engage with them, but we still don't have the data on what is going on there.
Thank you. Mr. Prando, how do you make TVET colleges attractive? Because I think that's something that we don't deal with someone will not see it as good as UCT, but there's this push by government to make it as, alternatives, but how do you make it attractive? Because students don't really want to go to some college or UCT, they want to go to the university. So what's government's plan with that? And also I see here, with basic education and also transfer to universities, there's a gap when it comes to rural schools. So there's always issues of infrastructure. I think Minister Mtsenga last week was here. She talked about trying to find a way of registering schools that are underdeveloped and trying to make sure that those schools produce the best students. But how do you make sure those students who might not be as equally privileged but are clever do end up in the higher education system? What's that gap going to be like for government? And my last question is on data costs. I see here that I'm not sure who deals with that, trying to lower that. It looks like the big networks are not playing ball. So will there be legislation? Will there be fines? Will there be a way that CASA can get them to play ball to make sure that the data costs are lower in South Africa? Because they are the highest ones we have, also one of the highest ones in the countries compared to other developed countries and underdeveloped countries. Thank you.
My name is Trinity Mutambe from the Media Connection, representing community and media space. My question has got two disciplines in it, health and education. From the health point of view, I think about 10 plus years ago, we had an animal called Nyaupe. We didn't see it coming. Today it's an issue.
We had a what? Oh, Nyaupe.
And what we see happening, particularly at granular detail level, which is community, there's a phenomenon called Habli Babli. It's slowly eating up the attention of young people in this country. And we haven't heard much messaging from an education point of view in this regard, whether it's a healthy thing or not, but the issue here is it's taking so much attention from young people. I would just like to find out from the ANC and particularly from the health and from the education department, what is it that is being done to help educate these young people about the effect of this product called health development. Thank you.
Yes.
My question
back the former President and they
this foundation. Can you introduce yourself and the media outlet that you come from?
Thank you. My name is Kanita Hunter from the Sunday Times newspaper. Minister Mutuli, what I want to find out is that two things. The first thing is the concern raised by former President Kgalema Motlanthe over the fact that when you have these dual competencies, you have the National Department of Health and then you have provincial departments of health. And when national government then assigns certain money for health, for example, and he says, premiers then can come in and divert that money to other areas. So I was going to talk about that, the constraints or the lessons you've learned from having this dual competencies, and whether it's going to work going forward. The second thing I want to find out, Minister, is when the Northwest was going through a lot of crisis at the time, there was an issue about, you have to then work with people in provinces who are actually at the coalface of actually delivering services, but you don't have a say in who gets implemented. Who gets appointed rather. So as a Minister of Health, the Minister cannot dictate who will be the MECs for health. These are people who are in charge of rolling out healthcare in different provinces. So my question to you, there was a discussion about changing that policy. A, is it still a concern to you? And B, has there been some changes to that process? Because sometimes there seems to be a disconnect between what you say and what you want to do as a minister, but what actually happens from the people who are responsible for delivering services. Thank you.
Okay. No, thank you very much for the questions. We'll then allow our panel members to answer. I'll start on my right because then finish. Yes, Comrade Mamoloko on the data.
No, thanks. Thanks very much, Comrade Dakota. I think the issue around data and where we are approaching it, firstly, it's under Minister Ndabeni Abrams, who's responsible. Recently, I think this week as well. What day is it today? On Thursday. Yeah, on Thursday. When she issued a statement, cabinet statement, she spoke about the work that has been done, progress in terms of releasing spectrum, and also making sure that we are able to get data costs coming down. Now, in terms of all sectors playing ball, it's the issue of collaboration. Obviously, private sector, the MNO, mobile network operators are here, their business run. So would not expect them to really just do as we wish, but we have a regulatory framework. We have an area in terms of policy where we can be able to give directive in terms of what needs to be done, how the prices can be done, working together with our regulator. That's why we spoke about Competition Commission, which is the responsible body to be able to check in terms of either the competition, the prices are competitive, because I know in the public space, especially in social media, a lot of people have been even showing that we're paying more for prices compared to other on the continent, and that's part of what the Competition Commission should be able to check for us, whether the prices, for example, if you have a mobile network operator operating in South Africa and on the continent, but the prices, there is no synchron, they will be able to help us there. Secondly, in terms of ICASA being able to regulate, they've started with the issue around making sure that data does not expire, you are able to transfer. That's first step. I mean, there's been quite a lot of improvement around that area. I think the issue has been the speed that it has to take. It's a litigious environment where if you don't deal with it properly, then you end up in court. We've seen in many areas. That's why it's important for both the policy maker and also the regulator to always follow process so that we don't end up in court where it delays in terms of the work that we do. I think that's one I wanted to deal with. Just on the issue around, maybe speaking to issues broadly around the use of drugs by young people. And I think there's been quite a lot of attempts from government to say, let's work together to ensure that we have a drug-free society. Because it starts from basically just young people drinking alcohol even at the ages where you don't expect young people to drink alcohol. And most of the time, some of us, when we move to high schools, talking to children, and most educating them about the brain development, where they stop it because of taking alcohol and drugs. Cabinet released an approach in terms of, we started looking at how we can be able to have a drug master plan, anti-drug master plan for the country to show the seriousness. We would have seen from even the ANC and president of the country moving across in society, in communities, talking to mothers who are affected, talking to families that are affected, because it eats away the children in our communities. It affects our young people. I mean, I've been deployed in Mabopane for some time, where Nyaupe is a problem. And it starts there. That's why it's important for us to not only apportion the communication and the messaging to political leaders, to government, but to all of us as society, including in our homes, to be able to say to our children, it's not cool to do drugs. So we need role models, especially at peer level. The youngsters who are in the industry, entertainment industry, who can come out openly to say this is not right, so that we can have a society that converses around issues of drug, because it's a societal issue. It needs all of us. Thank you.
The first question from the citizen was about whether we have got a plan about immigrants. Yes, we do have, and we are going to outline it, or rather we have already done so. It's only that you didn't see the documents in the NHI, because there are international conventions that apply in such situations. One of the weaknesses we have got in South Africa is that when we have got migrants, large number of them, regardless of how they came into a country, in many countries they are in a confined place held by international organizations like the International Office on Migration, the Red Cross Society with healthcare, etc. I'm sure you are aware that that's not happening in South Africa. There's no particular individual organization that is helping. Whoever is here is sick goes to our own institutions. So we have said with Home Affairs, looked at all the acts that they have got in Home Affairs that are applicable. Look into countries which have got universal health coverage, like the UK and many others. How do they deal with, if you migrate to the UK, because they are using national health system, which is exactly like our NHS. Our NHS is based on the British model. How do they deal with these problems? We've put them in there, in the act, and when we release it, you are going to see it, because remember, it's still going to go to Parliament, and then for public participation, you'll see all those proposals. What is being proposed, I can't go into them, but we definitely have got a plan, which is based on the Constitution, it's based on international conventions, it's based on on practices that are done in countries that have got an NHS system like ourselves, and we'll put them together and show them to you. The second question is very complex. Yes, and that's why it was so long. Chairperson, very complex. But because it arises all the time, especially on TV, where people are even accusing the state for doing nothing, I might have to explain it. This College of Medicine issue that we are talking about is as old as I am. Yes, I qualified in medical school in 1983. Right from the time I arrived, there was this uproar about the College of Medicine, that people are being failed. And let me explain, because now this is a press conference, but you were given a chance, and since you raised issues with the media, I would like to make them understand. During that time, when my early days at medical school, there was no College of Medicine in South Africa, because College of Medicine is not a medical school. It's an examination institution. It's where people go to get their senior degree. And the center is here in Parktown. Either you can go to Parktown and do that. The other center is in Rondebosch in Cape Town. The other one is in Durban. You study in whatever university for 4 years. After finishing community service. That means you do medicine first for 6 years, you do internship, you do community service, then you choose any university that has got a post for you. You study for 4 years. When you are ready, you say, I want to become a specialist. Then you write to the College of Medicine that I want to write my exam. Then they will refer you whether to come to Rondebosch or Parktown or to go to Durban. When you arrive there, the people who are going to examine you, they come from all our medical schools in the country. There are no people in the college who are examiners. They go to all the medical schools which are there, and you are aware that there are 9 of them, if we count the new one in Limpopo, which has not yet produced a doctor, by the way, but is there. They get them together to examine you, written and oral. And when you get your results, they are from people who are from the all 8 medical schools. Now, during my time, such a college did not exist. People used to study here and go to England. Yeah, to the what is called the Royal College. It's Royal College because during the early days when you are kept, when you are graduate by the Queen of England herself. So it's called the Royal College. There can be a Royal College of Gynecologists, Pediatricians, Psychiatrists. It depends in which specialty. Then you get that degree called FRCS, Fellow of the Royal College of Surgeons, or FCP, Fellow of the Royal College of Physicians, or FCOG, Fellow of the Royal College of Obstetricians and Gynecologists. So it was British. Then a decision was made that no, let's bring it here home. We can no longer be British citizens forever. We know they've colonized us. They brought it here and they dropped the R because we are not a royal. You know, they dropped the R, then it remained at FCS, Fellow of the College of Gynecologists, etc., etc. Now, during that time, my dear, I'm trying to look at your age. From here, I can't see it very well. There was an uproar from Afrikaners in this country who claimed, because I'm saying it's a claim because I've got no proof, who claimed that the college is controlled by the Jews. And if you are an Afrikaner or any other, you'll never pass, no matter how hard you have studied. And they lost that complaint. It was severe, to an extent where Afrikaner medical schools pulled out and formed their own senior degree, which was called a master's. There was no master, which is called MED, Master of Medicine in Obstetrics and Gynecology. So they dropped the college issue because they said you are being failed. So the master's was found in only Afrikaner-speaking universities like Pretoria, etc. Yeah. Then eventually, the problem was resolved. They said, let's unify the degree. We can no longer have 2 different degrees, one for Afrikaners, the other for the English, in brackets, as they were saying Jew. I'm just telling you what was said during that time, during my era. Now there is a new uproar that it's Africans that are being failed. Now we said we cannot use the same method and say we are putting African new only degree. We must transform the college. Now, issues of transformation are always a question mark forever. I said with Professor Satefe, who is the head of the Department of Nuclear Medicine at Steve Biko. He is the present president of the college, to explain to me this war about transformation, and explained. He even gave me the figures that most people in the board are now black. They've got more black people in the board than they were whites. They were trying to follow demographics. But this outcry is there. We'll have to look at it. The 8PSA, which you said doesn't have control. The 8PSA is a statutory body, Health Professions Council of South Africa, whose president is Dr. Josile Tlapi, you have quoted. He can't control the college. He only controls the ethics of doctors, their registration. The only thing the 8PSA can do is to pass a curriculum. If you say, I'm going to train people in this type of curriculum, they take it together with the chancellors, what do you call them, the vice chancellors, the committee of, yes, the Senate of the Vice Chancellor's University will also look at the curriculum and pass it. That's all that can happen, including me. Both me and Dr. Letlape cannot determine who must pass in the college. It's a difficult issue. I can't say you have failed too many black people, increase more and all that. It's an independent institution of professionals examining themselves and giving certificates. But every year they are very much aware of this issue of transformation, and they talk about it a lot. As to what they are winning or not, we'll have to look into it. The other question is Nyaupe. Yes, it's a very big problem in our country. But the drug master plan is not in the Department of Health. It's in the Department of Social Development. We are members where they develop the drug master plan, how drugs must be controlled in the country. It's not regarded as a medical issue much more than it's a social issue. The Happily Bubbly, if I'm not mistaken, are you talking about that pipe where... Yes, I've seen a lot of it in Northern Cape. What we are doing is, you are aware that we have submitted to Parliament the new laws about smoking, and there is e-cigarette and that Happily Bubbly. We want to classify them as a cigarette because there are laws in the country which says you can't do this and that in a cigarette, and there is a gap. That when that law was passed early in our democracy, this Happily Bubbly was not there, and the e-cigarettes were not there. So we want to classify e-cigarettes as cigarettes because many of them have got nicotine, and the World Health Organization is supporting us on that. So I'm sure in the new Parliament, that bill will come forth. Together with banning the 25% smoking in public places, we want to ban it. There should be in an area like this. When we say public place, we don't mean out there in the air. We mean inside institutions like this, inside hospitals, schools, hotels, airports, and all that. So we are going to include it on that. Now, Kwamita from Sunday Times, the dual competencies. It's a big problem, but I've tried my best to explain many times. Part of the reason why we have got problems in healthcare system is that there are 4 areas where the competencies are never dual, but people keep on talking about dual competencies. On the issue of human resources, as you said, it's not a dual competency. It's a clear competency of provinces. I've got no say in the hiring of anybody working health in any province. I know that when they are expelled, they come to me. But yes, they come to me emotionally or socially. But in terms of the law, or maybe politically, let me say, in terms of the law, there's no law that gives me any power to make a decision about anybody employed in the public health care system in a province. In terms of employment, in terms of charging them and discharging them and all that, there's no legal basis on which to do it. So that's number 1, human resources. It's not a dual competency. Number 2 is financial management, as we have said. Many people believe I determine what provinces must get. Treasury determine how much each money is sent to any province. When it arrives there, you are right. The Premier called the Executive Council. They decide how much money to send to health, how much to education. That's why Gauteng this year, and is the only province, for the first time since this democracy, they've sent more money to health than in education. It has never happened before. It was not done by me, it was done by the Gauteng Executive Council under Makura. That is legal competency. That's financial management. 3 is the issue of tenders. Let me call the procurement. Yes. Procurement of things is not done by me. It's done at the provincial level, except procurement of things like ARVs where we do it together, and issue the contract together. 4, the issue of infrastructure and equipment. So what we have said was, if we are going to have a national health insurance, these issues must be re-looked at. If you look at the national health insurance bill, even the first one we produced, we are putting there 12 acts that needs to be amended to change these things we are talking about. The 12 acts, one of them is the National Health Act, which was passed in the year 2003, and the Mental Health Act, which was passed in the year 2002. In fact, even before we go to NHI, if you read the Life is the Main report, the UMBAs reached the same conclusion, that the reason why one of the reasons why Life is the Main happened is because of the manner in which those acts apportion power. And one of the 18 recommendations of the Health Umbad is that we must review and amend the National Health Act 2003, review and amend the Mental Health Act 2002 to try and deal with these issues of dual competency. The other one is a political question about the minister having to appoint MECs. I'm sure you are aware, no minister in any department appoints any political, they are all appointed by premiers, and I've never fought for that space to appoint them. I just want them to do the correct things.
Thank you very much, colleagues. I think Ms. Hunter meant civil servants. Appointment of civil servants, not MECs. I think that's what was being referred to.
Yeah, there's two parts to it. The first part of it is that MECs, the Minister of Health faces care.
Yeah.
But MECs, he knows obviously MECs political, but it's also the civil servants.
Yeah, that's what I thought you were referring to. Yeah, HODs. Yeah. It was HODs. In the manifesto, you would see in the chapter on governance that one of the areas we've identified as an area in which we need stronger action is ensuring intergovernmental planning and execution. We've identified it as a weakness. So where there are concurrent functions, there should be far more collaboration in planning and execution than we've had up to now. So it is an area that will receive great attention from government, and indeed already I think President Ramaphosa has begun to give greater focus to this. However, the notion that national has no power when there are concurrent functions is not so if you look at the Constitution. I think what has happened is that national departments and political officers have not used the powers that are in the Constitution, particularly in the setting of national norms and standards and other aspects that do allow for intervention and that do give the national department a far greater role than it exercises sometimes. I'm not a good one at this. Comrade Anwar would be the one who really is a master in this area of the Constitution, but there is space in the Constitution for us to have far more influence than we use at the moment. To come to the questions on education, we are really strengthening efforts to make colleges attractive. One of the things that I'm really excited about are these centers of specialization that we've begun implementing from this year. It's 26 colleges. We are introducing 13 trades in those colleges. Each of them will offer 2 of the trades. And we are partnering with the private sector. So every young person that comes into these programs comes in with an apprenticeship contract with industry. So in that way, they know that when they complete their program and are qualified, they then have an employer to go to. And their work experience will not be an afterthought. It is part of already their entry into the program. I want to see that kind of model between the public, the institutions, and the private sector as a common phenomenon in vocational and technical education in South Africa. We're working with international partners to implement this, looking very strongly to what is done in Europe, for example, and then looking at examples in countries such as India, which has made some strides, China, Korea, and so on. So through that, I think we can begin to ensure that we are far more attractive. And I was intrigued just 2 weeks ago by a story in the City Press where you had a young person who began at a TVET college and just last year completed his PhD at Oxford. So he has shown, I think, through the way he managed his studies, that it is possible to make this transition from college into university and beyond. And that's what we want to see. So already we have partnerships between colleges in the Cape and universities in the Cape. Students who complete their artisan training will proceed to a professional degree with accreditation by the university, credits for what they've done at colleges. But it's something that you have to plan, you have to work in alignment. And it's happening in some of the regions of our country. I'd like it to be a national phenomenon. These are some of the ways. Then, of course, we must have the best workshops, the best equipment. You must know, if we're training you as an auto mechanic, that you'll be able to work on a Mercedes-Benz or Toyota engine because where you are, you have the most modern workshop with a live Toyota engine that you acquire your particular skills in. we're working on this, and if you were to walk around with me from time to time when I go to colleges, you'll see we've got Komatsu engines, we have Volvo in some of our colleges, Mercedes and so on. And in fact, some of industry are already putting up their own training workshops. So already the dual system of in-industry training is beginning to happen in South Africa. And I think with time and good communication and a focus on different things by the media, we will be assisted. Because it's not all just protests, it's not all just doom and gloom. There is quite some amazing stuff happening out there. And of course, for the majority of students in the college sector, access is free because they're funded, the bulk, by the state. And it's also less costly than university study. On this gap between schooling and university study, we provide funding for bridging and foundation programs in several of our universities throughout the country. And it is these programs that support young people to succeed. One of the most successful are programs you have at Stellenbosch on maths and science, programs in engineering, foundation programs at University of Cape Town, some of the pre-med programs at University of KwaZulu-Natal. So funding is a standard that has been there from when I was long ago Minister of Education. And these have had an important impact in the system. We also fund, through the National Student Financial Aid Scheme, rural-based NGOs like REAP to identify students who need funding so that they don't feel they're so distant from funding sources that they never consider applying to tertiary education. So we work with rural-based NGOs or NGOs working within rural communities, provide funding to them so that they can assure students of financial support prior to them leaving school and coming into the tertiary sector. So a whole range of initiatives that we support. We have a very vibrant government program called the University's Capacity Development Grant, which supports initiatives such as the ones I've referred to of foundation, academic development, and so on, because also lecturers do not have the skill to teach a diversity of students. So you have to provide funding to improve competence in those particular areas. We also have a specific grant for historically black institutions, which also enhances their teaching capacity as well as the materials and other resources that they provide for students. There's a great deal out there, and all of it is directed at ensuring that South Africa has the level of skills and competence that our economy requires, and that young people who wish to acquire specific skills are not left out because of a lack of financial resources. Thank you very much, Chair. Comrade Ander.
Thank you, Comrade Naledi. It's quite interesting following up on the Minister of Higher Education and Training. Long ago we worked together, and she had the notion of special schools. And today in Soweto you have a school for aviation and you have a school for maritime studies. If you go to the Eastern Cape, you have a school for agricultural studies. These were the schools, special schools that the Minister Pando had conceptualized at that time. We created legislation for that particular purpose, and it's a reality. But beyond that, also in terms of skills, is the reality that we've already got a vocational stream. Our first cohort of matriculants wrote last year. It's vocational in terms of civil engineering, mechanical engineering, electrical engineering, and technological engineering. So that stream is already up and running. This year we're doing a large pilot on 26 subjects for the occupational stream. And obviously we would have to work very, very closely with the Minister of Higher Education and Training to ensure that there is an alignment between what happens in the TVET colleges and your technical schools. So there's going to be a greater diversity and opportunity for our learners. But I think two important issues that we have to recognize is, what is it about data? And I'm glad you raised this. The Department of Basic Education has digitized 95% of its textbooks which is now owned intellectually by the Department of Basic Education. So data becomes very, very critical in terms of access to quality education. And what is interesting is that these textbooks for all subjects in all grades are made available to everybody. So it's not party political based, it's for the entire country, and it's about the best interest of our child. And quite interestingly, we were able to do that through public-private partnerships. It costs the taxpayer nothing. So that's a wonderful start to the fourth industrial revolution. But there's something even more exciting. We've entered into an agreement with service providers, and our education cloud will now sit with the service providers such as Vodacom, MTN, and Telkom. And anybody who accesses that data would be zero rated. Now that's a wonderful initiative by the ANC-led government, and I think it's really going to take education from the public good to the public domain. But an important area that you've raised is about what about accessibility to institutions of higher learning because of the disparity in terms of achievement. It's a wonderful narrative. In fact, what excited us most, indeed the President was particularly excited about this reality, is that last year our no-fee schools produced more distinctions than our fee-paying schools. Last year, our no-fee schools provided more bachelor's passes than our fee-paying schools. So slowly but surely, the equity is becoming a reality in our education system, and you will have more learners coming from no-fee schools going to institutions of higher learning on merit because of the ability to perform so well under more difficult circumstances. So that's a very, very important area to look at. I thought Minister Pandor had really outlined extremely well the issue of concurrent competencies. And that affects particularly health sector and the Department of Basic Education. What is very interesting is, 25 years ago we had 18 departments of education. And as a result of the concurrent competencies, every education department could determine whatever textbooks would be provided for every child. The provincial department would determine what examination would be written in different subjects. And yet now, 25 years thereafter, we have one education system, one examination for all provinces, and nobody complains about it. So there is a norm and a standard that applies uniformly. That wasn't done through legislation. It has been done quite organically as a result of a system that we've developed collectively and collaboratively. What is very, very interesting also with regard to the textbook feature, whereas schools and provinces used to do so quite independently, there's now a reality of provincial centralized procurement and national centralized procurement for textbooks and stationery. And I think that is what the Minister of Health is alluding to. That is the way in which we've got to go. And indeed, the reality is that there are huge savings that occur as a result of that collaborative and collective way of doing things differently. But the issue of concurrent competencies is an issue that requires attention, because it certainly can be constraining at times if you have a difficult province, as it were. But quite interestingly, if the approach is correct, and this is what the ANC-led government has done, with regard to infrastructure to replace unsafe schools, we've delivered more than 225 schools, but 25 of them are in the Western Cape, state-of-the-art school that has every amenity. Because we followed the best interest of the child, and it didn't matter. We depoliticized education to look at that particular reality. So it doesn't matter where your child is, the ANC government has been able to serve. Let me conclude by speaking about the issue of drugs. And quite correctly, again, Minister Pandor and the Minister of Health said it's led by the Department of Social Development. But we are part of that particular conversation. So basic education participates. And it participates with trade and industry, with the Department of Health. So some of the realities, in fact, the draft legislation had been prepared, is that there won't be taverns near schools or churches or places of worship. An important reality. There would be no advertisement on alcohol, and that would be legislated upon. There would be a reduction in, right now, if you have alcohol limit of 0.08, if it exceeds that amount, you could be charged for criminally. We thought we should make it even higher. So these are realities that would be introduced by this ANC-led government. But with regard to education itself, we certainly, it's part and parcel of our curriculum. and it's a compulsory area. It's life skills or life orientation. We've developed guidelines for educators, guidelines for parents, guidelines for learners in terms of how to deal with issues of alcohol and drug abuse. So that has become a reality. We've asked all our committees, all our governing bodies to establish safety committees that would look at creating a safe and caring environment in our schools. So I thought I'd just share this from the perspective of the Department of Basic Education. Thank you very much.
Thank you very much, Comrade Enver. Thank you very much, Comrade Enver, and the panel. Let me also finally thank all of you for honoring our invitation, all media outlets.
Sorry, I'm so sorry. I don't know if anybody else is dealing with this elsewhere in the country, but you've just issued a statement about the incident, the Shuvia book, and the story that came out in the two papers today. I don't know if you're going to take the opportunity, since we're all here, to maybe deal with it and let us ask questions about it.
Not in education, not in health.
No, that one is aside. We can have a one-on-one on it. Yeah. No, thank you very much, ladies and gentlemen. On behalf of the President of the African National Congress, President Cyril Ramaphosa, and the National Executive Committee, we would like to thank you for honoring our invitation. All of our comrades of the panel are available after this briefing for one-on-one in case you want any one of them. We'll make them available for you.